Hello students, the topic today we are going to discuss is the surgical methods of contraception. What are surgicals basically? What is surgical? Surgical means it involves incision on the body, a cut on the body. A cut could be a smaller cut or it could be a bigger incision, a bigger cut. But whenever incision is involved or a cut has to be made, anesthesia has to be given. So the organ first of all has to be made anesthetized so that the patient should not feel any pain, and this kind of process are normally irreversible. In case of women, the surgical method of contraception is tubal ligation, and in case of men, it is called vasectomy. So basically, surgical method of contraception is nothing but by use of surgery or by making a small cut or an operation, the reproductive capability of an individual, or you can call it as to control the population, the reproductive system of an individual, whether it is female or male, is made in or modified in such a way that there is no reproduction. The fusion of gamete is prevented by having this small operation. So we will now see what is the surgical contraceptions in case of female and in case of male. In case of female, as I said, it is called as tubal ligation. Ligation is the meaning of making a cut. Ligation is meaning cut. So what is cut basically? The fallopian tubes. Now we have seen in the last lecture that the egg travels from the ovary through the fallopian tube to the uterus. And in the fallopian tube, that is the site of fertilization, where the egg and the sperm fertilize together, and then the egg travels to the uterus. So if this channel, if this duct, if this tube is blocked, or if it is cut, or if it is disconnected from the ovary, there will be a very less chance of fertilization. So there won't be any fusion of the sperm and the ovum. So even if the ovary is actively releasing out the ovum, even if uh, there is a release of sperms in the reproductive system of the female, the sperm won't reach to the ovum in the fallopian tube, so there won't be any fertilization. So basically what happens, the fallopian tubes are tied, cut, sometimes they are clamped, like these are clamped over here, you can see these are clamped, or they are banded, then they are tied and banded and sealed closed. So how they do it, they make a small incision in the abdomen, and with the use of a small uh, kind of a camera-like instrument known as laparoscope, which is inserted in that small incision. A small cut is made in the fallopian tubes, and then they are tied or clamped. For making that cut, the female is given anesthesia, local anesthesia, and the female recovers from the effect of the anesthesia very soon. So the patient can actually, this happens, a small operation which is done, a minor operation which is done, and the patient can go home after a few hours of the surgery. The problem with this is, if this is clamped, in such cases, if this is clamped, it is not 100% effective, because if the ovum, if there's a small gap in the clamp, ovum can travel from the fallopian tube, and the fertilization can take place. So this is one method of surgical contraception in female. The another method of, so that is the procedure. What are the side effects? That is not 100% effective. Hemorrhage could be one more side effect. Hemorrhage is like bleeding. So making cut or during the procedure, if the cut is too deep or if the cut is not, if the female is not having a proper clotting time, if the clot of the blood is not happening, there could be a hemorrhage of internal organs. And the side effect could be, if there's a cut, there could be a secondary infection. The site could become a site of secondary infection. So the female, other than the hemorrhage, could also suffer from secondary infection like bacterial infection, and all the side effects which are associated with the influence of the anesthesia. So it could be the organs may not recover, the female may undergo different side effects of anesthesia. So those are involved. Another surgical method of contraception is called as hysterectomy. Hysterectomy is basically the surgical removal of the whole of the uterus. Now, this is one method. Now, this could be used, but it is not only used for contraception. Sometimes the whole uterus is removed if there is any chance of uterine cancer. But this hysterectomy can be one of the surgical method of contraception. But the problem with hysterectomy is that there is no menstrual cycle. A bigger incision has to be made, and the female, it is an irreversible kind of procedure. You cannot reverse it. Means the female, once the uterus is removed, the female cannot conceive again. So because there's no ovary, there's no. Sometimes only the uterus is removed. Sometimes half of the uterus and the ovary is removed. Sometimes the whole of the reproductive system is removed. So this type of surgical contraception is irreversible. Now we comes to the surgical contraception in case of male. In case of male, the reproductive system comprises of gonads, a pair of testes, and these are distended in an external sac known as sac scrotum. And the gametes which are generated in the gonads are released out from the body through a duct, a copulatory organ, which is called as penis. And the duct which carries the gamete from the gonad, that is the testis, to the copulatory organ, is called as vasa deferens. Now, vasectomy is basically cutting of the vasa deferens. So, vasectomy, cutting of the vasa deferens. So, just like how in case of the tubal ligation, over here in males, the vasa deferens is cut tight. It is safer, it is less painful than the women's sterilization method. Also requires cutting and sealing and blocking the vasa deferens. So this is how they are cut, they sealed. So it prevents the transfer of the sperm out of the penis. But there's one more gland associated with the male reproductive system, which is called as the prostate gland. The prostate gland is responsible for the secretion of the seminal fluid. So even if the male undergoes vasectomy, the male will still ejaculate, but the semen of the semen of the male won't contain any sperm. It will only contain the seminal fluid. So there would be a like normal process of copulation, but the male won't release out any sperm. This process gives 100% efficiency, 100% guarantee of sterilization, but it is an irreversible process. Once the vasectomy is done, it cannot be reversed. So the male cannot become a father, cannot produce a baby once he has done the vasectomy. But because it is 100% effective, it is practiced. The procedure involves uh, use of local anesthesia. Small incision is made in the upper part of the scrotum, that is the sac in which the gonads, the testes are hanging up, and then vasa deferens is tied off and cut apart. That's the small simple procedure. The male, the female means the patient can go home on the same day, and it is 100% effective. The disadvantage of this process, even the tubal ligation or the vasectomy, is that this process do not prevent the diseases, the communicable or transmission of sexually transmitted diseases. Those diseases which are communicated via the reproductive or the copulatory organs, those diseases like gonorrhea or syphilis, the communication or transmission of such diseases is not prevented through surgical contraceptive methods. Other thing is that these are not irreversible. So once it is done, it cannot be reversed back. So if the couple change their mind of going for another baby, they cannot go, they cannot do that. So it's like a permanent way of sterilization.